my name is Gary Fredericks, former board chair, Memorial Hospital, and president of the Gulfport branch NAACP.
I'm Dr. Antoine Rizk. I'm an interventional cardiologist in the Memorial Healthcare System.
February is Heart Awareness Month, and there are particular shortfalls and lack of knowledge, particularly in the African American community. So unfortunately, Dr. Rizk and we began a relationship in the emergency room where he saved my life. So it's always been important and conscious to me to make people aware of heart disease, of preventive care, and being knowledgeable and listen to your body when it comes to heart concerns. For me, being an African American, what would you tell me to tell the community and people that I know of not preventive care, of awareness that they should pay a close attention to so that they can prepare and be more knowledgeable when it comes to their heart and their health?
Very good question. As we know, prevention is the best cure. And that's actually even more important in a high-risk population like the African American population. The reason being is because the disease is more severe in the African American population, and maybe hopefully we can touch on that later on as to what the causes are. It also occurs at a much younger age. And fortunately or unfortunately, most of the risk factors involved are modifiable risk factors, which means awareness and people taking care of themselves and maybe have a better understanding of the disease and its repercussion and its morbidity and mortality long term. Maybe they'll be more invested in being more aware and make effort to really follow these preventive measures.
Living in the South, in certain populations and demographics of people who are on a fixed income and they have poor eating habits at a young age, because what we're seeing now is a lot of challenges, as you say, younger people are more at risk. So let's talk about preventive measures, things that people need to concern in their diets, such as dry foods, soft drinks. In particular, I want you to talk about the impact that I see these young kids every day drinking a full can of Red Bull and a donut.
Well, what's important in heart disease is that now we have so much understanding, and we know that by far the most common cause of death in almost any gender and any race is heart attacks. Okay, so now we know exactly what causes a heart attack, how it's built up, and we know that this starts in your 30s. The plaque starts in late 20s, early 30s. It gets really worse with time, and there are multiple factors involved. Let's talk about the most important, one of the few important ones. Genetics. All of these disorders are genetically encoded. If your parents have them, you have them. So if the cholesterol was high among your parents, yours is high. The only way to treat it, unfortunately, is medications. Cholesterol, 10% comes from diet, 90% is genetically encoded, comes from the liver. So we have to block production. In some people who are at high risk, we don't do it on everybody, but that's one factor that makes a big difference. The other one is, as you mentioned, overweight. Like in particular, in the African American population, something called the metabolic syndrome, which is a triad means three things: hypertension, hyperlipidemia, and glucose intolerance or diabetes. So if you're overweight, and we have clear data what we mean by overweight, not everybody who's overweight gets that, but it's based on waist circumference and body size and all that. If you develop metabolic syndrome, your likelihood of having heart disease is extremely high. And those are younger folks. Those are folks in their 30s and 40s. And this is where we can make a big impact, because those people, not only they get the disease, they get a severe form of the disease, and they get it at a much younger age. Again, since we're talking about prevention, being aware that, when your mom and dad had a certain issue in their 60s, if you're not going to do anything different, you really need to get on a preventive program, which will make a huge difference. We all know what is healthy, what isn't, and I usually don't let my patients, as you know, go to any website because they only confuse themselves, but that's the only exception, which is when they ask me about diet, I cannot be any more clear or specific or detailed than the American Heart Association. So you go to AHA.org and download the cardiac diet or even diabetic diet. It tells you which serving of each you need to have per week. It even tells you if it's a tuna, salmon, chicken. I mean, how many fruits and vegetables. Just put it on a magnet on your fridge.
So in continuing, let's talk about cardiovascular exercise. Because most people say, I can't run, I have bad knees, short of breath. Talk about the simplicity of just 20 minutes of walking to make a difference.
I am so glad we've spoken about that before. I'm so glad you asked that. Because when you tell people exercise, they kind of panic. They think you have to go out, have a gym, get a trainer, buy these expensive Lululemon stuff, and then go to the gym, and you're like the fattest person there, deconditioned, and people will judge you. Well, it doesn't. All you have to do is walk. A 30-minute walk. Doesn't have to be a brisk walk. 5 days a week is already very good exercise.